Guys, in this video, we want to look at syphilis. So basically, syphilis is a sexually transmitted disease, STD, right? Or you can say sexually transmitted infection. It is caused by bacteria. The bacteria is Treponemal pallidum, right? You have heard so much of this, Treponemal pallidum. Do you remember looking at it in microbiology? This is how it looks. These are spirochetes. They're motile, if I'm not wrong, right? Spirochetes. This spiral. See? You need to have dark, what is this? Dark ground microscope. You can see it with the help of dark ground microscope. They have stained it with some India ink or Fontana silver impregnation. Okay. So basically you can see here it is causing all these kind of chancre, right? Painless sores these are, right? And here you can see some rashes also on the palms and soles. So basically syphilis is a sexually transmitted disease, but it can also happen that it is transmitted to the fetus, right? To the baby from the mother. Okay. So it is also a congenital syphilis you can find. And what you should know here is there are two forms of syphilis, guys. So you have understood now. There is one acquired form which is sexually transmitted, etc., and the other one is congenital. Okay, guys. Actually, whenever there is torch, they talk about torch infections in a pregnant woman. They are referring to this T. Actually, refers to toxoplasma. They are saying you can take it as Treponemal pallidum also, right? Rubella, cytomegalovirus, herpes simplex virus. In others, actually, they have included agent of syphilis, which is Treponemal pallidum, which they could have included under T also. What do you say, people? So people, now let us look at the adult one, okay? Acquired syphilis, STD. So in acquired syphilis, you have early syphilis, then you have, in that early you have, look at this one, you will know. In acquired syphilis, look at this, acquired syphilis, you have early and late. Under early you have primary, secondary. Under late you have the tertiary, okay? So this, did you understand? Primary, secondary, tertiary you have, actually you have latent, okay? The latent, when it presents, it can become a cardiovascular or a NeuroSyphilis Tabes, dorsalis. All these terminologies you will hear, right? All those come under this latent, late, okay? So syphilis, the incubation period, they are saying it's a very high range, right? 9 to 90 days, if you want, you can remember that. They're saying here like 2 weeks to 3 weeks also. 7 2s are 14, 7 4s are 28. So yeah, so 2 to 4 weeks also they have mentioned here. Anyways, so basically, where will the chancre, okay, chancre, where will this be? In the primary lesion, it will be there in the genital area, in the site of infection. You should remember this. That's the site of infection. It's an STD, isn't it? So there will be, what type of thing? There will be a single painless chancre, hard it will be. It will be a genital ulcer. It will be indurated, okay? What do you mean by indurated? Indurated, again, they are same thing, they are saying hard base, okay? And, what else they are saying here? The lymph nodes, again, painless, non-tender, everything here is painless. So we'll put a smiley here, okay? He got some rashes and all those problems, but it's all painless, okay? This is the primary syphilis, okay? These will resolve within 2 to 6 weeks without treatment. So more smiley, okay? They can leave a thin scar though. So it can happen male, female, everybody, guys. Male penis, then female vaginal wall, cervix, okay. Extragenital also can happen, okay, in some people. Now what happened? That guy got some problem. Now that problem is gone by itself. Now, but what happens? He has not taken any treatment. Secondary syphilis will occur. So what will happen? Here there will be rash, palms, soles. Right, we showed you that photo of palms and soles. So basically here they are saying that there is some Buschke Ollendroff sign. So basically when, you know, there will be deep dermal tenderness when you press the lesion, okay, with a pinhead. So that is what they are saying is Buschke Ollendroff sign. So do you remember that photo? Palms and soles they are showing, okay. So let's get back to the textbook. Okay, so secondary syphilis, basically you remember. Okay, so palms and sole rash that you understood. Now there is one more terminology in the secondary syphilis, guys. That is Condylomata lata. Okay, see, condylomata, lata, basically these are highly infectious. Lata actually means broad. Why they are using this word? See, all the papules are coalescing to form plaques. So that's why it is so broad, you can say. These are highly infectious, guys. Don't confuse this with condyloma acuminata, which is seen in anogenital warts, okay. So basically condylomata, lata, okay, in secondary syphilis. So here, the differential diagnosis of secondary syphilis can be so many. So if you see secondary syphilis is very difficult. So many things looks like secondary syphilis. Basically psoriasis, pityriasis, rosacea, scabies, etc., etc. So many things. Okay. These people can also have alopecia, hair loss without scar. That is like a moth-eaten kind of a alopecia they can have. So now we are done with what and all are we done with? Primary and secondary. Now what will happen? Secondary also will resolve without treatment. Okay, relapses can occur, etc. After that, the disease will enter the phase of latency. Now we are going to latent syphilis. Basically, what will happen here? The serology will be positive. See, the presence of positive syphilis serology. Okay. Diagnostic cerebrospinal fluid abnormalities. Okay, of neurosyphilis. So basically, guys, so there is no evidence of clinical disease, but there can be neurosyphilis, right? Abnormalities of neurosyphilis in an untreated patient with no evidence of clinical disease. Okay, so there is here in latency, there are two things, guys. Early latency, that is within 2 years, if it comes, it's early latency. Then you have late latency. So easy, isn't it? Look at this. If you're, you will have not had any sexual contact at all, but still you will be carrying the Treponemal pallidum. And a pregnant woman to a fetus, the transmission of syphilis can happen several years following infection. Okay. So that's what you should know. That is why they are telling syphilis means early latent, late latent. So many terminologies here. Now coming to late syphilis, in that you have late latent. Okay. Now, let's move on here. You have something called as tertiary syphilis here, isn't it? So there will be gummatous lesion. So basically it means rubbery kind of lesions. There is gumma of the tibia, skull, clavicle, sternum. All this you should know, right? Then coming to cardiovascular syphilis, guys, there can be aortitis, that is called as syphilitic aortitis. The thoracic aorta can be affected, guys, and the aorta, the vessels can look like tree bark appearance. There can be aortic regurgitation in these people also. Okay, how will tree bark look? I'm trying to draw a tree bark here, something like this, right? A tree bark appearance. Okay. Then coming to neurosyphilis, guys, basically neurosyphilis, there can be, you can check the CSF, you can do a CSF VDRL, there will be CSF abnormalities. These people can have Tabes dorsalis. What is this? Very important term this is. Tabes dorsalis. So here they are saying this progressive degeneration of the posterior nerve root up to the dorsal root ganglion, is it? So there will be loss of pain, position, vibration sense, loss of passive movements, lack of coordination, ataxia they will have. Okay, so this is all you have to know. There can be Argyll Robertson pupil, right? You know that there will be constricted pupil in both the eyes, right? So that will be Argyll Robertson pupil. So basically here there will be accommodation but no light reflex. You remember this Argyll Robertson pupil? Both pupils are constricted bilaterally. So this is also called as prostitute's pupil, but it can affect men and women. Okay, obviously. Light reflex is absent, but accommodation or near reflex is present, right? And this is caused by neurosyphilis, right? That's what they said. So in this, if you give mydriatics to dilate the pupil, it was of no use. Anyways, guys, that becomes too much of ophthalmology for you, right? So we are done with acquired syphilis. Let's jump to the treatment. First of all, what investigations you'll order, guys? You can collect the serum, right, from chancres. That is from those lesions they are collecting. Okay, so let us from this lesion they are collecting, and they are checking for those bacteria. Okay, dark field microscope they are doing, and they are checking. Also, you can do enzyme immunoassay. Okay, you can detect the antibodies. You can detect the antibodies in enzyme immunoassay. You can do VDRL, that is Venereal Disease Research Laboratory, this test, right? VDRL test. You can do rapid plasma Reagin test. Okay. So all these are very important, guys, these names. Then you have that FDA ABS also you can do, right? So guys, there are some non-treponemal tests which are not specific. In that VDRL will come. Okay, this is non-treponemal. This and all you should know, guys. Non-treponemal, non-specific test. This is. Then RPR also, rapid plasma Reagin test. Then coming to treponemal, that is specifically you can check. In that you have the FDA ABS. So if they ask you, which is really good, you can go for this one, right? Then you have enzyme immunoassay also we told you. Okay, so again they are trying to detect what in this? The antibody, right? They're checking for IgG and IgM. Guys, how is it going, guys? Are you able to understand anything? We are actually looking at syphilis, okay? So guys, remember to write this in the exam, okay? Serological test for syphilis, non-treponemal, VDRL, RPR, specific treponemal, you have the enzyme immunoassay test, okay? Then you have the FDA ABS, that is fluorescent treponemal antibody absorbed. ABS is absorbed. A is for antibody, treponemal, fluorescent. Fluorescent treponemal antibody absorbed test. FDA ABS, will you be able to say that? FDA ABS, fluorescent treponemal antibody absorption test. Guys, within this treponemal test, right, there are so many. Like you can use the live Treponema pallidum, the killed Treponema pallidum. So many types are there. In microbiology you can read, okay. Under treponemal itself, you have using the live, using the killed, etc., etc., etc. Let's just take a recap of this acquired syphilis from this pathology textbook. Primary syphilis, painless, okay, they healed without scar. Then histologically, what will you see? So this is another good thing, right? In investigations, you can look at this. So look at this typical microscopic appearance in the case of syphilitic gumma of the liver, okay. Central coagulative necrosis is surrounded by palisade of macrophages and plasma cells, marginated peripherally by fibroblasts. So necrosis, plasma cells, fibroblasts, joint cell, lymphocytes, okay. So this is how it looks, okay. Then that is the primary syphilis. Secondary syphilis, what are you seeing? Highly infective stage, they have said, okay. Then coming to tertiary, what did you see here? Syphilitic gumma, rubbery lesion, okay. Then you have the cardiovascular syphilis, which is affecting the thoracic aorta, right? NeuroSyphilis, affecting the meninges, Tabes dorsalis, affecting the spinal cord. Gumma are ulcerating granulomas on skin, bone and internal organs. Gumma. This is from the microbiology textbook, diagnostic methods in syphilis. So we already told you this one. You will do, where is that? Dark ground microscopy, and you will demonstrate those spirochetes. You can use silver impregnation method, etc. Right? Then you can do a non-treponemal test like VDRL, RPR. Treponemal test, you can do FDA, ABS. Okay. So some live Treponema pallidum, killed Treponema pallidum, then using pallidum extract. So many methods are there. Now let's go to the management of acquired syphilis, guys. So here we are talking about penicillin G. Basically, you will give benzathine penicillin. Remember, you have to write this word benzathine penicillin. Okay, this is the one that you have to give, penicillin. Okay, benzathine penicillin you have to give, antibiotic, right? Basically, it's the drug of choice. Benzathine penicillin you will give for syphilis, guys. You have to just give single dose of 2.4 mega units. Okay, so single dose 2.4 mega units. Guys, focus 2.4 mega units. Mega is capital M, right? Mega units. You will give single dose of 2.4 mega units of what? Benzathine penicillin. You have to give IM. Okay, intramuscular you have to give. For early syphilis or any type of syphilis, actually this will help. For late syphilis, you will give the same thing, 3 doses. Okay, for late, you will give 3 doses of the same thing. Okay, in 1 week interval. Okay, weekly, 1 week interval. See, this is weekly interval, 3 doses. Okay, so you will give for latent, late syphilis, you'll give 2.4 1 week, and then you will give 2.4 mega units another week, and then 2.4 mega units another week. So this is latent. Okay. When it comes to neurosyphilis, only neurosyphilis, guys, you will not give benzathine penicillin, you will give procaine penicillin, because you wanted to cross the blood-brain barrier, so you will give procaine penicillin. Okay. What will you give for syphilis? Benzathine penicillin for everything. Only for neurosyphilis, procaine penicillin. Very good. And you should always give a test dose of this penicillin, okay, guys, because they can have anaphylactic reaction. So you'll give an antibiotic test dose. Okay. And what else? For neurosyphilis, you will give a 14-day course. Every day they have to take this procaine penicillin. Okay. So in pregnancy, what you will do is you will screen the patient for torch infections, and if you find this syphilis, all these lab diagnoses, if they are positive, you will have to again give her penicillin only. Okay. What will you do, guys, if these people have a reaction to penicillin? You will have to keep adrenaline ready, right? Epinephrine. Guys, shall we now move on to congenital syphilis? Are you okay? So congenital syphilis, guys, here basically you should know that they have divided this again into early symptoms or late symptoms, like that. You should know, okay. Congenital syphilis, as soon as a child is born, how will you know that it is having syphilis, right? So all that you should know. See, basically for the mother, what will happen, she will easily transmit this syphilis bacteria to the baby, okay. The baby, what will happen, it can, the fetus, it can land up with miscarriage, stillbirth, premature birth, etc. It's going to be a very sick baby, they are saying here. Then what else? Focus, guys, now that this baby is out, okay, early congenital syphilis, how will you know, okay? So this is a early guy, okay. So here, this people will have some vesiculobullous rashes, maculopapular rashes, okay, they can have rhinitis. I wouldn't have ever suspected rhinitis to be a syphilis, actually. Very interesting, right? Just a rhinitis is actually snuffles, they are calling it as. So that could be an indicator of syphilis, interestingly, right? So then there can be hepatosplenomegaly, both the liver and the spleen could be enlarged. There could be osteochondritis, periostitis, something to do with the bone, cartilage. So what will happen? They won't be moving those parts, so it can be like a pseudo paralysis. Lymphadenopathy generalized because it's an infection, and then there could be anemia, thrombocytopenia. These are early indicators of congenital syphilis. What is interesting is, they are not giving any clues like fever or anything. Isn't that interesting? Because I would have just, put somewhere here early congenital syphilis, or is there some fever or something? But fever, etc. is very mild even in adult. See, actually in secondary syphilis, they have mentioned mild fever. In that also they have used the word mild. So anyways, fever, etc. they're not at all bothered. Shall we continue, guys, to the late congenital syphilis, guys? That is, after many years, they are saying that late congenital syphilis, how will it look? Okay, there can be deafness in that child. There can be interstitial keratitis. That is, the keratitis is what cornea, right? The layers of the cornea, the middle part is affected. So whenever they ask you interstitial keratitis in the exam of ophthalmology, you'll never realize that they're asking syphilis, isn't it? Okay, so interstitial keratitis, then Clutton's joints, painless effusion in knee joints. So there is painless effusion in knee joint. Clutton's joint, Cluton. Let's draw a baby, or actually a child now that it's after so many years. And then here in the knee, painless effusion into knee joints. This is Cluton joints. Where will you see syphilis? Late congenital syphilis. Okay, Syphilis. Okay, can you say Cluton? Cluton. Painless. Effusion. Into knee joint. Syphilis. Yeah, thank you. So basically then let's look at this. There is something called as Hutchison triad. That means they will have Hutchison teeth. Okay, that is, the teeth will be something like this. We'll show you Hutchison teeth. And then they will have this deafness, that is sensory neural deafness, and they'll have interstitial keratitis. Okay, so that is Hutchison's triad. Let's look at Hutchison teeth.
The teeth are like W.
Yeah, the teeth are like W. I'll show you it. Look at this image here. Hutchison teeth. and sensory neural deafness, and here they are showing you interstitial keratitis. They are just trying to depict it, okay. So these are the components of Hutchinson's triad. So basically what will there be there here? Interstitial keratitis, Hutchinson's incisors, small, widely shaped, widely spaced, peg-shaped, permanent teeth. Oh, permanent teeth. Eighth nerve deafness, vestibulocochlear nerve, cranial nerve. They'll have mulberry molars, imperfectly formed cusps, deficient dental enamel. Okay, something to do with the teeth, mulberry molars. Let's see if we can find an image for this. They have shown something like this, mulberry molars. Hutchinson teeth. This is actually mulberry. So do the teeth look like that? Mulberry. So they'll have a saddle nose, okay, following the snuffle. So saddle nose means how that baby will be, no? Flat nose like this, right? So I want to make the nose look more flat. Flat nose, saddle nose. A lot of terminologies, guys, in this congenital syphilis, like this. Ragates, radiating scars around the mouth, nose, anus, following rash. How will it be? Like a cat, is it? Ragates, radiating scars around mouth, nose, and anus, following rash. Okay, ragates. Then they are talking about sabre tibia. Okay, because of this periostitis and etc. You saw there can be sabre tibia. Sabre tibia means anterior bowing of the tibia. So where is the baby? Let us say this is the baby, lateral view. So this anterior bowing of the tibia. Anterior bowing of the tibia. This should be the tibia. So the anterior bowing of the tibia. Sabre tibia. Syphilis. Okay. Then bossing, frontal bossing. Frontal bone bossing can be there. This frontal bone bossing and all we have seen even in rickets, I feel. So investigations for suspected congenital syphilis, what are they doing? So basically they want to use a positive enzyme immunoassay test for the IgM for early congenital syphilis, okay. So basically what will happen, maternal antibodies also would have come. So they can give a positive serological test in her baby. Okay. So management, they have not spoken of any specific congenital management actually. The only thing this textbook, that is Davidson, says is babies should be treated in hospital with the help of a pediatrician. Wow, that's like so generic. Anyways. So guys, in this video we wanted to look at syphilis. The first thing you should know is the syphilis spelling. Okay. S-Y-P. Okay, S-Y-P-H-I-L-S. So we looked at, this is an STD caused by Treponemal pallidum bacteria, spirochetes. So basically we looked at the acquired one and the congenital one. So many terminologies we have learnt. In acquired, actually you have the primary, secondary, latent, latent, tertiary, neurosyphilis, cardiovascular syphilis, etc. Tabes, dorsalis, so many terms there. In secondary, you saw condylomata, condylomata, lata, okay, in secondary syphilis. So you have primary syphilis, secondary, then you have latent, and that you have late latent, you have tertiary, right? You saw all that. The secondary one is very similar to many other conditions like psoriasis, etc. So there are a lot of differentials for that. Late syphilis, tertiary syphilis, gamma, etc. Cardiovascular syphilis, neurosyphilis, you heard the word tabes, dorsalis, etc. Right? Then, what did you see in adult itself? You will do investigations, you will do treponema, you can try to check this under the microscope, right? Under dark field microscope, you can do non-treponemal tests which are not specific like VDRL, RPR, etc. Then you can do the specific treponemal test like enzyme immunoassay, etc. In that you have a live treponemal, killed treponemal, treponema extract, etc. Then you saw the treatment, guys. Treatment is same for everything. Benzathine penicillin, except for neurosyphilis, you will give procaine penicillin, okay. And how much you will give? 2.4 mega unit single dose, okay, for all types of syphilis. But for late one, you will give 3 doses, okay, at weekly intervals. For neurosyphilis, we told you that you will give procaine penicillin. That will be a 14-day course. Every day you will have to give. You should be very careful about the anaphylactic reaction to penicillin, okay. Then coming to congenital, what did you see? Congenital syphilis. You saw that there is early congenital syphilis, there is late congenital syphilis, and then some other things. Early, basically, they told you there will be rash, vesicular-bullous rash, rhinitis, snuffles, hepatosplenomegaly, osteochondritis, periostitis, lymphadenopathy, anemia, etc., thrombocytopenia. Then you come to the late ones, there will be that Hutchinson's triad, eighth nerve deafness, interstitial keratitis, Hutchinson's incisor teeth. Then you have Cluton joints, right, where there is effusion. There is painless effusion, that is Cluton joints, painless effusion into the knee joint. Then you saw the Hutchinson's incisors, mulberry molar, saddle nose, raggades, okay, basically radiating scars around the mouth, nose, anus, etc., following this rash. Then you have the Sabre tibia, Sabre, S-A-B-R-E, Sabre tibia, guys. Do you remember all this? Sabre tibia from periostitis, anterior bowing of the tibia. Then you have bossing of the frontal bone, etc. So, guys, when it comes to prevention, what will you say? You will use barrier method of contraception, etc. Right? Barriers they should use. You will talk about all that in sexually transmitted diseases, safe sex, etc. Then you can talk about mother to child to stop. What will you do? You will have to screen pregnant women for syphilis. Okay, you check the torch infections and treat the mother with penicillin so that she gets cured and she does not transmit it to the fetus. Okay, what else you should know, guys? That's it for now, guys. In this video, we have completed almost everything about syphilis, from microbiology to pathology to medicine to dermatology to everything. Okay, that's it for now, guys. Bye bye.